Hi, my name is Dr. Brittany Todd with Sacred Heart Clinical Pharmacy Specialties. I am a pharmacist, a mother, and a wife, and I want to start a series on birth control. I'm going to start with the history of birth control leading up to some definitions and then what actually we use for birth control today. So let's start at the very beginning. In Egypt, in ancient Rome, people were using birth control. They were using things like alligator dung, honey, certain chemicals as spermicides. They were using some forms of birth control even way back when. Maybe they weren't the most effective, but they were using them. Fast forward to about the 1920s, almost every world religion, especially the Christian religions, were against birth control. In the 1920s, the Anglican Church was the first Christian church to at least formally say that it was okay to use birth control within a marriage as long as the husband and wife discerned together whether or not, spacing children or not having any more children was prudent in their marriage. So the 1920s kind of opened the floodgates of permission, if you will, for the Christian faiths to say, yes, birth control might be okay as long as the discernment within a family is there. The Catholic faith has still maintained that birth control is still not okay. So that is the one faith, the one Christian faith, and there's probably a couple, random Christian faiths throughout, spread throughout the world that still believe this, but the Catholic Church is the one that teaches no contraception, no birth control. But the 1920s kind of opened the floodgates of accepting birth control. So in the 1960s, prior to the 1960s, the definition of pregnancy was the moment of fertilization. So a woman was pregnant the moment the sperm hits the egg and a zygote is formed and a new life begins. That was prior to the 1960s. If you look at the American College of OBGYNs way back when, that was the definition in their textbooks. But in around 1960 to 65, the definition actually changed. The definition went from the moment of conception was the moment of pregnancy to the moment of implantation, meaning that zygote that was fertilized is now implanted into the uterus. That's when pregnancy begins. So they changed the definition of pregnancy. And you might ask, why did they change the definition of pregnancy? Well, I'll tell you. In the 1950s, pharmaceutical companies started looking at ways to prevent ovulation or pregnancy, right? So in the 1950s, some pharmaceutical companies were looking at higher doses of estrogen and progesterone levels. And the first medication they started looking at were high-dose estrogen pills. The estrogen pills, birth control pills. And they were testing it on women, fertile women, and they found that the high doses of estrogen actually stopped ovulation. So if you don't ovulate, you don't get pregnant. So the pharmaceutical companies were excited about this. However, the women taking the birth control pills were not excited about this because they were having headaches, sweating, nausea, vomiting. High doses of estrogen don't make you feel very good. So they found that the women who took their medications felt awful. And then some people didn't take the medication, so they were getting pregnant, because if you don't take the medication, you're going to ovulate and get pregnant. So it wasn't effective if you don't take it, but if you did, you felt really crummy. So what they did is they thought, well, let's just decrease the estrogen dose of these birth control pills. So when they did that, they reduced it to a tolerable level where these women were not getting such major side effects, but it increased ovulation rates. So that didn't look good either. All of a sudden, women were getting pregnant on the pill in these studies. They felt fine, but they were getting pregnant. So you can't claim that this is a birth control pill if women are getting pregnant on the pill. So they decided, well, let's add in the progesterone component of the pill. So estrogen decreases ovulation, but it doesn't completely eliminate it most of the time unless it's very high levels of estrogen. So in the normal tolerated doses of estrogen, a woman can still ovulate. Doesn't mean she ovulates every time. It just means that she can still ovulate. And we can go over the ovulation rates on certain ones in a future video. But what they did is, because they lowered the estrogen dose and the ovulation rates went up, they couldn't have fertilization after after an egg was fertilized and they created a zygote, they created a new life. So what they did is they said, well, we can make it so that the uterus is hostile, meaning instead of being a nice cushy pillow for that little zygote to move into and implant into, it will make it dry, and there will be no mucus, no cush, nothing for it to implant into. So the progesterone makes that uterus a hostile environment. It's like putting a toddler outside when it's negative 20 degrees and saying, I hope you survive, right? It's creating an environment for that zygote, that new life, to not implant. So what happens is they give a lower dose of estrogen hoping that you don't ovulate, but then if you do and you happen to conceive a child, that child has nowhere to implant. That was its second mechanism. And they found out that, wow, lo and behold, women were not getting pregnant anymore. The problem was pregnancy before the 1960s, when they were developing these medications, pregnancy was defined as a moment of fertilization. So if they made the uterus hostile and that fertilized egg has nowhere to implant, it caused an elimination of a pregnancy, right? It ended a pregnancy. Well, most Christian faiths and most people at the time believed that if you were pregnant, they didn't want to end the pregnancy. They didn't want to kill the baby. So they changed the definition of pregnancy around 1960 to 65, when these birth control pills were first coming out on the market, from the moment of conception to the moment of implantation. Which means now people are being told this doesn't end a pregnancy, it prevents a pregnancy, because they shifted the definition by about 7 days. It takes about 7 days from the fertilized egg, that new zygote, to move down the fallopian tube into the uterus. And it doesn't implant. So medically, the definition of pregnancy is the moment of implantation. So medically, we're not eliminating a pregnancy, we're preventing a pregnancy. The problem is there is no definition for life. The definition of life is a growing, breathing, nutrient-needing thing, right? It could be a person, a dolphin, a plant, whatever it is. They need air, they need food, they need a good home, right? So this definition doesn't affect life, but it did affect the word pregnancy. So when they said that pregnancy did not happen until the moment of implantation, it changed the word for abortion. Abortion is the ending of a pregnancy. So what they did is, instead of ending a pregnancy in the beginning of fertilization, they ended a pregnancy at implantation. Do you see what they did? Their birth control pills were no longer abortifacients, or medicines that cause abortions. They are medicines that prevent pregnancy. They don't prevent life per se, they prevent pregnancy. That's the history of birth control, and I want to go into what kinds of birth control there are, and what are the risks of ovulation and possible fertilization and possible implantation as we go forward in these videos. What is birth control? Birth control is a big encompassing term for anything that prevents pregnancy. Like I said in the other video, pregnancy has changed in its definition over time depending on where society has an acceptable level for birth control. So birth control can range from anywhere from barrier methods, that would be a condom, that would be a diaphragm, anything that prevents sperm and egg meeting, that's the barrier method. Some IUDs, intrauterine devices, are barrier methods. It can also be toxins. So if you use a spermicide, it kills the sperm because it's toxic to sperm. So that's a birth control. Another birth control would be sterilization, right? You get a vasectomy, or you get your tubes tied, a tubal ligation, and you physically can't get sperm or egg out of the tubes to get to each other. That would be sterilization. And then the last and most common is hormonal contraception. Hormonal contraception is where you use hormones like estrogen and or progesterone, and they either inhibit ovulation, sperm movement, or they make the uterus hostile. So I like to focus on the hormonal contraceptives because as a pharmacist, the medications make the most sense to me. I'm trying to educate people about these medications. So hormonal contraception works by inhibiting ovulation. And then if that doesn't work all the time, which it doesn't, and you do happen to fertilize an egg, the progesterone comes in and says your uterus is hostile. So if you have a fertilized new zygote coming down the fallopian tube into the uterus, it has nowhere to go. It dies. It doesn't have a cushy pillow to implant inside of. So there are three mechanisms of birth control, hormonal contraceptives. They come in oral, they come in intramuscular injections, they come in vaginal rings and patches. There's just different ways to take it. They're all in one hormonal contraceptive. If it has estrogen or a progesterone component to it, it is a hormonal contraceptive. So the estrogen is the piece that stops ovulation, or should. The progesterone piece, and if you're on a progesterone only pill, we call them POPs, progesterone only pill, those only impact the uterus. There is a high likelihood that you're still going to ovulate if you're on a progesterone only pill. So that means that you can still fertilize an egg and a new life begins and starts moving its way down to the uterus, but it has nowhere to go. So when you menstruate, the baby will slough out with the rest of the endometrial tissue. So hormonal contraceptives are the big one, especially in the Catholic faith, that says absolutely not, because we believe in life and the value of life at the moment of conception. So if there's still any risk of ovulation, even though you might not get pregnant based on the definition of pregnancy that the ACOG changed in the 1960s. And if you don't know the information on that, go back and look at my other video. But they changed that definition in the 1960s. So you could still ovulate, but you're not pregnant, but you do still have life in you. So this is why especially the Catholic Church says no birth control, especially no hormonal contraceptives, because you don't know if you ovulated and then possibly lost your baby because you made that environment hostile to that zygote. So what are the risks? Like, what are the rates of ovulation? How often do you actually ovulate? Well, it depends. So some low dose estrogen pills, the really low estrogen oral contraceptives that have higher progesterone levels, those ovulation rates are significantly higher. They hit to like 30, 40, 50%. If you're on a low dose of estrogen, you ovulate 30, 40, 50% of the time. That means that there's a 30%, 50% chance of you conceiving a child, but you're not going to get pregnant because it doesn't have a chance to implant. Now, some of the higher dose estrogen pills that we have, their risk of ovulation is like 0.2%. It's very, very, very low. But again, it's not zero. There is still a chance that you conceive a child, don't even know it. It moves down the fallopian tube and has nowhere to go, and you slough it off at menses. That's the moral issue. We don't know if you're ovulating or not. You have a 0.2% chance, you have a 50% chance. We don't know. Now, if you're on the progesterone only, you're more like the 50% chance of ovulating. Now, if you have an intrauterine device, let's say the Mirena, which is one of the more common IUDs, and there are some other ones that have the same progesterone or very similar progesterone component, that IUD actually has a 60% ovulation rate. That means that more likely than not, you ovulated. And if that's the case, you could have conceived a child. You just don't know. And that child had nowhere to go. That's the moral dilemma, right? With birth control. Now I want to get into not just what are the moral dilemmas of birth control, but I also want to get into the side effects of birth control. But before I get there, I want to talk about pro-life. So a lot of people say, I'm pro-life. The Catholic Church is pro-life. I'm Catholic, I'm pro-life. I believe that ending pregnancy is wrong. I believe that ending a life is wrong. But a lot of people will argue, well, if you're pro-life, you should be pro-birth control because birth control prevents babies from being conceived altogether. Well, that would kind of make sense. I guess, if you're willing to take control over God's plan of when you conceive a child. But it's truly not pro-life to be pro-birth control, because birth control in and of itself is anti-life. It's contraception. Instead of conception, it's contraception. So the very essence of what birth control is anti-life. And then when you do take it, there is a chance, a very high chance, a higher chance than we should even be acceptable, a very high chance of ovulating. And if you ovulate, there's a high chance of getting pregnant. So if you are pro-life and you truly understand how birth control works, and now you do because you just listened to my videos, you should not be pro-birth control. Because if you're pro-life and you believe that life begins at conception, yet you're still taking or advocating for a medication that could still allow you to conceive, but then give it nowhere to implant, that is not pro-life from the moment of conception. That is pro-life from the moment of implantation, which is essentially abortion. Birth control, most people say, oh, not a lot of side effects. It might make you gain weight. It might make you lose weight. It might make you a little bit nauseated. But overall, it's a beneficial drug because now you're not getting pregnant, right? Well, that's wrong. This is one of those medications that society has accepted the risks despite them being incredibly high. Almost every woman who has been on birth control can tell you that they have some sort of side effects. They have acne, they have breast tenderness, they have shortness of breath, they have headaches, nausea. Those are more of the common side effects, but the less common but still somewhat frequent side effects are super, super concerning. Estrogen, especially in birth control, can cause blood clots. This is why people with migraines, especially migraines with aura, when they start seeing vision changes and have severe headaches, women with migraines, especially with aura, should not be on estrogen-containing hormonal contraceptives because estrogen increases your risk of blood clots. And it complicates the picture because a migraine with an aura sometimes presents kind of like a stroke. You're having vision changes, blurry vision, severe headache. That sounds like a stroke, and we cannot tell the difference between a stroke and a migraine with an aura because now you're on an estrogen pill that increases your risk of blood clots. And a blood clot in your brain is a stroke. You see the dilemma there? If we give you something that causes a stroke and you happen to have a migraine with an aura, we don't know, is it just a migraine with an aura or did we cause a stroke? So that's one huge issue with birth control. They cause blood clots, not just in your brain. It can happen in your heart. It can happen in your leg and cause a deep vein thrombosis, a DVT. It can happen in your lungs and cause a PE, which is a pulmonary embolism, and a blood clot in your lungs, and that could break off, go to your brain, and cause a stroke. Strokes, lung clots, and heart attacks, clots in your heart can cause heart attacks, can kill you. These are not incredibly rare. In fact, I think Justin Bieber's wife had a blood clot in her lungs. I'm pretty sure. This is not that rare. I know several people who were told you cannot take hormonal contraceptives. You know who else is at risk of blood clots are women who smoke while on hormonal contraceptives. So blood clots are a severe, scary issue. Shortness of breath is a sign of a blood clot in your lungs. Chest pain is a sign in your heart. Headache is a sign in your brain or in your head. And red, puffy, inflamed, painful spot on your legs. Those are signs of blood clots in your legs. All scary things. So that's one major scary thing with birth control. The other thing is cancer. It is actually classified. Hormonal contraceptives are actually classified as carcinogens, cancer-causing drugs. Let me say it again. Hormonal contraceptives are also classified as carcinogens or cancer-causing drugs. We know they increase your risk of cancer because it's estrogen and progesterone at higher doses than your body normally produces. Yet we're sitting here saying, go ahead and take birth control. You know what? Let's start it when you're 10 and let's keep you on it until you're 45 and start menopause. And the only time you're off of it is, the 1 or 2 years here and there that you want to have a baby. But we're okay with giving hormones at abnormal doses to regulate your cycles the way we want to regulate them for 30 plus years. There was a study done probably in the early 2000s that looked at hormones in older women using it for hormonal replacement therapy. And they found that they were at an increased risk of blood clots, stroke, heart attacks, and cancer. And that was shorter term. That was saying, oh, you're going through menopause. We're going to put you on these hormone replacement therapies and make you feel a little bit better, get rid of your hot flashes, kind of balance out your hormones. And these women were worse off on these medications than they were not on the medications. Yet here we are saying, oh, it's totally fine to give hormonal contraceptives to women for 30 plus years. And we just give it to you and say, have a great day and hope for the best. It works. Do they work? Yeah. People don't get pregnant on them, but to what risk? These medications are not good for the body. They also change the neurodevelopment in your brain. They alter your chemicals in your brain. They actually make you less likely to want more kids. They decrease your libido. They make you think they just change the hormone function. Your hormones are meant to make you want children, right? That's the natural human race. We want children. Think about the millions of people out here right now who don't want children. Or they say, I don't want children now, but maybe when I hit 30, I'll want a child. So then I know that, maybe I hit 30 and I still don't want one, but I know I'm going to stop my birth control and just have one anyway, because I know I don't want one necessarily. I don't feel like I want one, but I know in my brain I wanted one my whole life. I'm not ready, but I just need to do it, right? And those people finally get off birth control and then finally want children. Speaking from experience, I went through this. I took birth control for several years. And I remember when I was on birth control, I was terrified. I was like, I do not want kids. I am not ready for kids. This is not a good thing. I am not having kids. And then I went through a Catholic class about contraception and conception and what it means to be married in a Catholic church. And for the first time ever, I thought, wow, maybe this is my birth control telling me I don't want kids. And I stopped my birth control. And within 3 months, I wanted kids so badly. And I think, truly, I do think that the estrogen and the progesterone that I was taking was suppressing the hormones that women have that help them desire children. The hormones have also been shown to change attraction between men and women. Women on birth control are more attracted to effeminate men. They're more groomed, they're a little bit more, feminine in their ways. They're not necessarily women, but they're just, they're a little bit more groomed and taken care of and just effeminate, right? But women off of birth control are more attracted to more rugged men who hunt, men who do, work with their hands and have beards and, they're just more attracted to manly men is what we would call that, right? And I think that is a huge impact that comes from using birth control. So I don't like to pretend that birth control causes no problems. Take your medicine, you won't have babies, we'll have a great day. Well, yeah, except you're gonna have increased risk of all these side effects and it changes your hormones. I want to talk about the people who say, but I need birth control, right? I don't take it for contraception, but I do take it for XYZ, whatever it is. Let me tell you about my personal experience. I have endometriosis. Endometriosis is the endometrial tissue is what makes your uterus nice and cushy. So when you get pregnant or right after you ovulate, it starts creating all that endometrial tissue inside your uterus to make it cushy like a pillow so that a baby, if fertilized, that zygote can come in and implant in that nice cushy pillow. But endometriosis is when that endometrial tissue doesn't just stay in the uterus, it gets out. It goes on the ovaries, it can go in the abdominal cavity, it can go everywhere, right? So what I was told when I was first discovering that I had endometriosis was just take birth control. Birth control stops that. Well, that's true, because birth control, especially the progesterone piece of birth control, suppresses the endometrial tissue so that it doesn't grow and make a nice cushy uterus. So if you get pregnant, it can't implant, right? Well, that happens everywhere, right? So if it suppresses the endometrial tissue in the uterus, it suppresses it everywhere else, right? So when I was going through my infertility issues and my endometriosis and the pain that came with that, they were saying, just take birth control. And I can see a lot of people saying, well, I'm done having kids. I already have 2 or 3 and I don't want any more kids. And so I'm not taking birth control because I don't want kids necessarily. I'm taking it because I don't like the pain from endometriosis. The problem is they just put a Band-Aid on it, right? They didn't fix the problem at all. They just gave you a medicine that stopped you from ovulating and causing the endometriosis to flare up every month, which is a normal thing that's supposed to happen in women. They just put a Band-Aid on it. As soon as you stop your birth control, seriously, like 3 days later, you're going to start your cycle back up and it's going to go right back into it. It never fixed a thing. So for me, I didn't want birth control. 1, I'm Catholic. 2, I'm pro-life. 3, I wanted children. And 4, that was not fixing the problem. So for me personally, I ended up having surgery where they actually went into my abdominal cavity and removed all of the random, endometrial tissue that was just all over the place. And that helped me immensely because they actually took care of the problem. They took out the problem. So I can speak from experience that birth control is recommended as a Band-Aid for most things. And yes, some people will take birth control for something else and not for contraception. I understand that. But there are Band-Aids and there are healing things. I chose the healing thing. So other reasons people take birth control not for contraception would be acne. You see that a lot in teenagers. I take it for acne. Well, if you give a 12, 13, 14-year-old girl birth control for acne, that's fine. She's probably not sexually active. I hope she's not sexually active. But if she is, or if she's thinking about it, she is now more likely to do it because she knows she's covered. There are other treatments for acne. Yes, there's over-the-counter medications. There's Accutane, which I do not like. I do not like Accutane. It is basically a chemotherapy that just kills the cells in your face. And you can't get pregnant on Accutane because it can severely hurt the baby. But there's spironolactone, which if it's a hormonal acne, spironolactone, which is not a contraceptive, can help get rid of the acne. Speaking from personal experience, that's what I needed. I took spironolactone and my acne cleared up in like a week or 2. So we're just throwing birth control with all these side effects and all these other repercussions on someone who just has acne. And I understand some acne is significantly worse than other acne, but birth control is not the answer. So acne is one reason people use it. Another reason is people have abnormal menstruation, so they might menstruate for like 3 months in a row. They just keep bleeding and bleeding and bleeding. So we give them a medication to help regulate their cycle. The question is, what's the underlying issue? Again, kind of like endometriosis, what is the underlying issue that's causing the bleeding? And why are we just putting a Band-Aid on it that as soon as we take that Band-Aid off, it's going to go right back to what it was doing? So this is where I start recommending reproductive doctors. I like Catholic professionals because they're not going to just start throwing you birth control. They're going to actually start trying to fix it. Is it a hormone issue? Maybe it is. And it's not contraception you need. It's just a hormone balance that you need. Maybe it's a thyroid issue. Maybe it's you have a cyst or a fibroid or something, right? There's reasons that people are not looking into. They're just saying, here's your birth control and have a great day. That's not okay. So, okay, I understand that there are other reasons to take birth control. And I have heard this from fellow Catholics saying, well, I don't take it for contraception. I take it for X, Y, and Z. The problem is if you're still sexually active while taking it, it is still working as a contraceptive. If you're not sexually active and you're taking these medications, by all means, your risk benefit, if you think that you need it, it's helping your symptoms, whatever, and they haven't found a way to fix the problem, fine. But if you are sexually active, you are, even though you're not meaning to take it for that reason, you are taking it, and it is acting as a contraceptive. So it's still causing you to reduce ovulation or reduce implantation. Regardless of the reason you're taking it, it's still acting like a contraceptive. I want to talk about not just birth control, but I want to talk about other life-giving procedures. So in the Catholic Church, we are anti-contraception. We don't like contraception. And I talked about why in previous videos, but we also do not agree with in vitro fertilization or surrogacy. And you might say, well, that's crazy. You're pro-life. If you're pro-life, you should want people to have children. And I absolutely want people to have children. The Catholic Church wants people to have children. However, children are a gift from God that we receive. They are not a thing that we take. We don't deserve children. We are gifted children. So the mindset behind IVF and surrogacy, and Lord knows, we struggled with fertility for years. And I understand how hard it is to not have the child that you so desperately want. I truly do. But I also understand that it's not my will, but God's will. And in vitro fertilization is taking God's control and putting it into your own hands and saying, God, you're not giving me a child the way I'm supposed to have a child, so I'm going to do it my way. And surrogacy is the same thing. So there are two things that happen in marriage in the Catholic Church that we believe are crucial to life-giving marriages. One is unitive, and two is procreative aspects of the church, of the marriage. So unitive means two become one, right? In Genesis, man leaves his wife, or leaves his mother and father and joins his wife, and the two become one. That's unitive. And union means giving your full self to your spouse. Not holding a piece back, but giving your full self to spouse. So let me give you an example of when you wouldn't be giving your full self to spouse. You're using a barrier method. You're using a condom. You're saying, I want to do this act with you, but I don't want to give you all of me. I'm going to block part of me in our union as a couple. Birth control, hormonal contraceptives, same thing. I'm going to give you all of me, except I'm not going to allow my body to do what it's meant to do because I don't want to conceive a child. So I'm going to take hormonal contraceptives, and that is my barrier, and we are not fully coming together in a union of marriage. Think of Jesus on the cross. I know that when you look at a Catholic crucifix, he's wearing, a cloth over his groin. But he was truly naked on the cross, and that was his gift to his bride. He had nothing else to give. There was no barrier between Jesus on the cross and his bride, the church. And that's what we're called to in marriage. We were meant to be united fully without any barriers saying, you can have 99% of me, but I don't want you to have the other 1%. That's the unitive piece of marriage. The procreative piece of marriage means that I am open to God's will. If God wants me to have children, I'm going to have children. He's the author of life. He's the one who gifts us children, and he's the one who doesn't gift us children. I have often said, because I've been on both sides, I now have 4 children because I went through surgery for my infertility and it fixed it, and I was able to have 4 children in the end. But in the beginning, we couldn't conceive. It took us a year to conceive our first, and it took us 5 more to conceive our next. And the whole time I kept thinking, maybe God's only giving us the one, and thank God he gave us the one. There is nothing harder than accepting God's will when it's not your will. And children are probably the most willed thing of people, right? I want children. And if God doesn't give me my child, I can't imagine how hard that would be to say, God, I want this. You know I want this, but I can't conceive a child. I'm going to do it on my own. So the procreative act in marriage doesn't mean that you will conceive. It means that you are open to conception. You're open to life. So let's bring this back to in vitro fertilization and surrogacy. Again, I understand the desire, the desperation, the need, the love that you are trying to pour into a child. I understand it. But they are neither unitive nor procreative. Why is it not unitive? Well, because man and woman come together and two become one. In vitro fertilization and surrogacy, both are not united in the marital act to conceive. One is in a room doing his thing, another woman is in the room getting a procedure done, and then a third party, a person, a doctor or tech or whoever, comes in, takes the sperm, takes the egg, puts it in a petri dish, and creates the life in the petri dish. So it's no longer man and woman to become one. It is man, woman, separate, third party, put together, create a life. The other problem with IVF is they will do that with multiple embryos, right? They will fertilize multiple eggs. And then let's say they have a petri dish of 10 fertilized eggs and 7 of them are viable. So they throw the other 3 out. Maybe they're not dead yet, but they don't look good. And then the other 7, they do some genetic testing and they say, oh, it looks like only 2 of them are actually viable for implantation. So then they get rid of another 5, right? Now you're down to 2. And that's what they implant in the body. So it's not procreative. It's not unitive in how they get there. It's not procreative because now they just trashed 7 or 8 of the embryos and only 2 of them are going in your body. Right? So how that naturally happened was so incredibly unnatural, and it was taking life into your own hands. God's not giving it to me, so I'm going to find my own way. Surrogacy is even worse. I mean, it takes IVF to a whole new level, right? IVF has all of its issues. It's not unitive, it's not procreative, and now you're putting that embryo, that baby, into a third party or fourth party at this point, right? Fourth party person to carry the baby for you. So they're growing a child as if that was their own child, as if they were the mother. And then at birth, they hand that baby over to someone else, which would be beautiful if it was adoption, because in adoption, the mother knows that she can't care for the child, but she accepted that life that God gifted her, and she's giving that gift to someone else. Surrogacy is accepting a transaction. It's saying, you can't have babies, I will do it for you. Let's swap and see what happens. And then we take the child away from the mother and we give it to the new parents. And that mother that just grew a child in her womb for 9 months will have no bond with that child. She's not going to nurse the child. Her body's made to take care of the child. She's not going to nurse the child. She's going to go through postpartum without a child. That baby's not going to have their mother, whom they automatically know how to snuggle and nurse as soon as that baby is born. They're not going to have that. It's interesting because we don't take puppies away from their moms until they're 8 weeks old. Puppies, kitties, kittens. But we take human babies away from their mothers within minutes of birth and hand it to someone else. And they might genetically be yours, but they weren't grown in your body. They don't have the smell. They can smell, they can hear, they can feel that mother who carried them. And in surrogacy, they just hand the baby over to someone else. So surrogacy is just the next level of in vitro fertilization. This is why the Catholic Church says no to surrogacy. It says no to IVF. The other issue with surrogacy is there are so many legal issues with surrogacy and IVF, really, because it's a property thing. So let's go back to IVF. IVF, you have to sign waivers and say, what are you going to do with these embryos that don't get implanted? What are you going to do? How many embryos are you going to keep? What happens if you get a divorce? They literally have to go through all of this. If you get a divorce and one person says, I want to destroy the embryos because I don't want my babies in my wife with someone else, a different spouse, or vice versa, right? So I want to destroy the embryos. And she says, I don't want to destroy the embryos. They're alive. I don't want to kill my babies. Who wins? Oh, I just want to put them in a freezer. We're not going to kill the babies. But then when those parents die, what happens to the frozen embryos? They either get destroyed anyway, or they move on to another family. The other family then gets the decision of, do we keep the embryos? Do we not keep the embryos? So eventually the embryos, do you see what I mean? It's a commodity. It's somebody makes a decision ultimately for life or death of these embryos. Surrogacy is its own legal issues. Surrogacy is, what if you conceive 3 babies? Let's say we implanted 3 babies in your uterus, and now you have 3 embryos growing, and the birth parents say, no, I don't want more than 1. I can't take triplets. That's too much. Now the surrogate mother has to abort 2 of the 3. Well, which one does she keep? Probably the more viable one, right? And what if she wants to keep them? What if she's growing these babies and says, no, I don't want to kill any of the babies. This is a transaction. This is a commodity. And you know what? In the law, the birth parents have the right to murder a child in the womb. And the surrogate has no say. Could you imagine being a surrogate mother and being told, sorry, we're going to abort 2 of them? And now she has to go through this whole procedure because she signed the paperwork and didn't think this through and is willing to kill 2 of the 3 children in her womb. IVF also mixes up babies, right? There was a story of a IVF provider who was using his own sperm. So instead of using the dad's sperm and implanting, he was using his own sperm. And he did this with, I don't remember how many children, but children started doing, their ancestry and their DNA tests, and they realized they were not related to their dad at all. They were related to the IVF doctor. And he probably thought they'll never find out because, way back when, 30, 40 years ago, they didn't have DNA tests like we do now. And now they found out that this provider was using his own sperm. So that child doesn't even belong to the dad at all. How horrific is that? There are so many bad things that can come from this. And it's because it's not the gift of God. It is trying to take it into your own hands. And when you do that and you keep God out of it, chaos ensues.